What's up, everybody? I hope you're doing well. Welcome to the extended cut, minimally edited podcast version of this week's episode, where we're going to talk about some of the reasons why the therapy relationship can end. I'm not sure if things have changed much since I was in graduate school, but at least back in my day, when we talked about clients ending therapy, it typically was taught to us as happening in one of two ways. Of course, there's the ideal gold standard where your client accomplishes all of their therapeutic goals probably on time, and you have a sort of graduation process session of sorts and send them off on their merry little way. And the other reason we were taught that therapy might end with a client is because the client wasn't ready, or they just, they were ditching what's in their best interest. And those were the only two ways that therapy ended, pretty much. So naturally, I was quite surprised as I launched into my therapy career to discover that there is a wide range of reasons why therapy ends with a client. And at least for me personally, when therapy ended for reasons other than like the client naturally arriving at a graduation moment with me, I started to carry shame around that because I thought that wasn't how it was supposed to go. But as it turns out, I'm not the only one. It's not that I'm providing some bad therapy or something, at least I hope. At the very least, this is an experience that I hear from so many other therapists. So I thought it would be helpful to share in this video so that, if you're carrying any shame around reasons why, therapy is ending with your clients, you can release some of that shame as well. The proper term for therapy ending with a client is termination, or the client terminating therapy or the therapist terminating therapy, depending on who initiates the therapeutic relationship ending. And personally, I have a deep beef with the use of the word termination to describe the ending of any kind of relationship. Like, I get that we use a different term than, say, medical doctors, because the therapeutic relationship is very much what the treatment is focused on in most theoretical orientations. However, in what planet does termination seem to make sense to describe that relationship ending? Even in the most intimate of relationships, it just sounds aggressive. I terminated my marriage. No, that's not the word we would use there either. So why do we use it with therapy? I don't know. Does anyone know the origin of that term? Is anyone advocating for the term to change? That's just always bothered me, so I just felt the need to say that here. But now that I got my little rant off my chest, let's talk about some of the reasons why the therapeutic relationship can end. Now, of course, it is very much possible for therapy to end in this sort of idyllic way that I was taught it was supposed to end, where you have this moment with your client, you realize that they have just reached their final goal in therapy and it's been sustained over a bit of time, and you have this check-in moment where you say, is it time? Did you do it? Did you do the thing? Are you ready to graduate? And they go, yes. And you have a termination session or two. There's that word, hate that word. You have a closing session or two where you reflect back on their growth and also how they're going to carry their growth forward without you. And you send them off like a proud parent into the world without you. And maybe tears are shed and everyone is just singing kumbaya. That was what I was pretty much taught. And that does happen. But let me just say, the number of times that that's happened in my career is minimal. I could count it on two hands, maybe one hand. That's very unusual in my practice that that's how things end. Now, that doesn't necessarily mean that all the other reasons for therapy ending are bad ones. It just doesn't typically look like that in my practice. It's not unusual for me to share with clients that, hey, I noticed, look at, you've set these goals for treatment when we first met. I'm noticing these changes. It looks to me like maybe you've met those treatment goals. What do you think? And they might say yes. And then I'll say, well, what would you like to do from here? Because we did the thing that you said you wanted to do. And it's not unusual for clients to say, well, now I want to work on this other thing. When that happens, I always tell clients it's up to them. Of course, they can leave. The door is always open. They can leave anytime. But if they want to keep working on other things with me, they sure can. We just have new treatment goals. Or if they want to, address those treatment goals elsewhere on their own, etc., they always have the freedom to do that as well. It's not unusual for clients to simply pivot treatment goals as we meet. But even accounting for that situation where the treatment goals pivot, it's not like I just keep keep meeting with the same therapy clients forever and ever and ever with endless treatment goals pivoting because therapy does end with my clients at some point. So there must be other reasons why it ends. Let's talk about those. It is worth mentioning the category of therapy ending that I think gets a lot of airtime, but at least in my experience is really rare, which is the angry client storming off from terrible therapy. There are certainly clients who get angry, and there's certainly clients who end therapy because they're angry, but the storming out in the middle of session because you said something upsetting to your client or something like that is extremely rare. I've never had somebody storm out of session. I'm trying to think about this in my years of being a therapist, at least in private practice. I've only had one therapy session where things ended during that session because the client got really upset with me and they said, I'm not coming back, which to me is to their credit, because most clients, if they're really angry with me and they're not going to come back, they're probably not going to tell me that that's where they're at. They're probably just going to disappear. And honestly, typically when I've ended terrible therapy experiences, I haven't necessarily declared it to the therapist either. I'll share some of those stories later in this extended version of the episode. But most clients don't get angry and storm out, at least not my typical clients. And that's not a story that I typically hear in consult groups and from other therapists as well. Now, back in my training days when I worked in inpatient contexts, someone storming out angrily might be a little bit more commonplace, but even then, it's not an everyday thing. It's just less unusual. So as I said, these more commonly taught reasons for why therapy comes to an end, at least in my experience, are some of the least common reasons why therapy ends. And I kind of wonder, this is just a thought and not based on any evidence, but I just wonder if because we're therapists, it's so in our nature to just take things to such a deep level that sometimes when we talk about why therapy ends, we focus on these really relational, deep therapeutic reasons or analyze them into some deep thing, when oftentimes the reason why therapy ends is very logistical, very practical. And in my practice, I'd say most of the time when therapy ends, it seems to be for some of these more practical reasons, or just, it's just not that deep. It's just not that deep sometimes. Sometimes it is deep. Sometimes it is deep, but just a lot of times it's not. So let's talk about some of the other reasons why therapy can end. One big one is clients moving away. This one is obvious if you're meeting with clients in person, and this would happen all the time for me when I was especially working in San Francisco, which is such a transient city. And at that time, working with a lot of college students or just recent graduates, people are moving in and out all the time. So that was one of the most common reasons why therapy ended for me in my earlier years. Now that was back in 2012. So obviously since then, virtual therapy has become much more commonplace. So you might argue that someone could move anywhere and still see their therapist. But the reality is, depending on where you're licensed, there are specific rules about who you can see and where those people can live. Another reason why therapy ends is, as you're working with a client, you're working on something that's in your wheelhouse as far as your therapeutic skills. And then either you come to realize that the client has something going on that's outside of your wheelhouse, or they have something new pop up that is not within your area of specialty or even qualifications. It's not that uncommon for me to be treating someone for a while. Let's say I was treating them for anxiety, and as the anxiety improves, we unearth something that was kind of lurking underneath the anxiety that might be a bit more outside of my wheelhouse. Maybe it's some sort of intense chronic trauma, for example, where I would feel more comfortable referring that person to somebody else who has a bit more expertise in that area. Or, maybe partway through treatment, somebody has an addiction start to crop up. And if that's not in your wheelhouse, you might want to refer that person to an addiction specialist. And kind of in the same vein, referring to a different therapeutic modality is pretty common and a common reason for ending therapy. By modality, I'm talking about if I'm working with someone in individual therapy, but I'm seeing that maybe they would benefit from couples therapy, then I might refer that person and their partner to a couples therapist and potentially end therapy with my individual client. I am fully aware of the different schools of thoughts about whether it's more ethical to have co-occurring individual and couples therapy versus more ethical to either do one or the other, but not both modalities at the same time. We're not going to get into that ethical dilemma today, but I'm just naming it. Another reason for the therapy relationship ending, which is so sad when it happens, is when the client just isn't making progress, or sometimes their symptoms might be getting worse, even though you're doing the best job you know how to help that person deal with whatever they asked for your help with. If somebody isn't improving after seeing you for some amount of time, especially if you've already attempted to change your approach to adapt to what this person might need and they're still not improving, it is ethically just so important to explore if working with somebody else could be a better fit for this client. It is not ethical to continuously work with somebody if you're not seeing any improvements whatsoever. Of course, when that happens, it's such a difficult conversation to have, but hopefully at the end of it, everyone sort of feels some sense of relief that maybe there's some hope that a different context might be more helpful for this client. And another reason why we might end therapy is because somebody is just not a good fit for us. Depending on what context we're working in, this might happen more often, especially if you're working in a setting where your clients are assigned to you and you don't get to do your own screening process. It's quite possible that some of those clients that end up being put on your caseload just are not a fit. You're not qualified to help them, or it could just be more personality fits. Like, okay, this person has some trauma with somebody of your kind of demographic background, and so they're going to be much more equipped and supported if they just had a different therapist, or your style, or whatever it might be. There's no need to kind of force it with the same person if you're not a good fit. You can always refer to a different therapist, and that's definitely a reason why therapy can end. Ideally, this would happen very early on in the relationship, not session 20, but maybe it's after one session or tops 3 sessions, in my opinion, to kind of sort through that and refer out appropriately. I'd say for me, because I'm in private practice, I do all my own phone screens, and I also have a very specific niche, and I turn away people who don't fit in my niche. I haven't seen this come up as much. I try my best to do what I can during the phone screen and be as thorough as possible, and also as forthcoming as possible about what to expect, and encouraging clients to explore other therapists before booking with me, that then by the time somebody shows up to their first appointment, at least me, I usually end up feeling like, oh good, this person is right in my niche, right in my wheelhouse, and I think I'm going to be able to help them. Another very common reason for the therapy relationship ending is finances. And even within the category of finances, there's so many different financial reasons why therapy might end. I mean, obviously, if somebody loses their job and they can no longer pay for therapy, that's an obvious reason why therapy might end for that person. But it could be that they got a new job. Maybe they were even promoted and they switched insurance carriers, and now, you're not paneled with that insurance carrier, so they're going to be referred to somebody who takes their insurance. And sometimes it just happens where a client has changing financial priorities. Like maybe they've been investing financially in therapy for a season, but they also have this other goal that's financially costly that they're then going to pivot into. Like maybe they're going to start school, or maybe they're buying a house, and there's enough stability, hopefully, that it makes sense to just pivot their financial priorities, and therapy is no longer kind of at the top of that list, so to speak. Now, the next reason I'm going to go over is just one that has been so kind of buzzy lately, but I think has been common for a long time. I don't think this is new, and that's ghosting. Basically, this is just when somebody never schedules a follow-up session, or they cancel a session and then never follow up to book again. I see this happen in my practice all the time, that clients will just drop off. And it might be something legitimate, like they legitimately weren't available to schedule a follow-up session. Other things in life became a priority. And then now a few months have gone by and they kind of realize, actually, I think I'm good. I'm genuinely good. I don't know that I need that anymore. And most people don't circle back to their therapist and say, hey, I know it's been 3 months. Just FYI, I think I'm good now. It's just oh, okay, you just don't book a follow-up appointment. That's a very normal human thing in most other service industry relationships. I don't know, if you see your hairstylist every 3 months for a haircut and then you decide that you want to grow your hair super, super long, like you're probably not going to reach out to your hairstylist and be like, I know you haven't heard from me and it's been 4 months, but like I'm going to grow my hair out now. So that's why you haven't heard from me. Like you're just not going to reach out to them. I think that's just considered socially appropriate in our world, even though as therapists, we're taught to make sure we do what we can to maintain that therapeutic connection where we can. I'd actually say for me in my practice, this is a very common reason why therapy ends, that just people kind of taper off. Maybe they no-show for a session and then I just like don't hear from them again. Or maybe they do get back to me when I reach out after they've missed a session and they say, yeah, I think I'm just realizing I have different priorities or, whatever it might be. And I'm not going to be booking for now. Like that happens fairly often. And I want to say for the record that is okay. Like I think it's really common in our profession to shame clients for doing this, but honestly, this is quite socially acceptable across the board. Like this is kind of how people do their interactions. So I don't think there's any need to shame our clients, whether it's towards them, certainly not towards them, but even amongst ourselves, like how we speak about it in consult groups or things like that. It's just like, oh, maybe that was just the way that person realized that they're ready to close the relationship. And that's great. They figured out what they needed or what they wanted. There's nothing wrong with that. It could be a great thing. Another reason why therapy can end is if a client is very inconsistent in their attendance or, they have a lot of no-shows, a lot of cancellations. They're kind of flaky in that way, or maybe they have totally legitimate reasons for needing to cancel so much, but they're just not able to access prioritizing showing up to their therapy appointment. Maybe they show up, but they're always super duper late. Then of course that always merits a conversation. And sometimes it is the therapist kind of initiating or suggesting that like, hey, is this really working for you? Like I noticed you've only come 1 out of your last 4 sessions and the one that you came to, you're really late. Like, is this something you really want to keep doing? And I think it is really valuable to have that conversation. And if you see it happening over and over again, it can make sense to end therapy. And it might be one of these other things going on too. Like maybe the finances are too much of a strain, or maybe it's not the best fit and that's how they're kind of showing it, or whatever it might be. You might kind of discover that through a conversation and potentially come to a close or refer out as necessary. And another reason why therapy ends is because depending on the context, there can be a time constraint on the therapy. So some third-party payers like insurance, or if somebody has some sort of coverage through their employer, they'll only pay for a specific number of sessions, and regardless of how you're doing at the end of those sessions, like they're not going to pay anymore once you get to that point. So if you're going to keep paying, you have to pay out of pocket, and that's not always an option for everybody. So the therapy naturally ends because you ran out of sessions. Again, regardless of how someone's actually doing, how their mental health is at the time that you run out of those sessions, the therapy then needs to end. The same thing can apply depending on what kind of work setting you're in as well. Like I'm remembering one time I worked at a school, and so, your therapy relationship naturally ends at the end of the school year. I also worked at a place that offered crisis housing where I forget what the cap was. Was it 14 days or 21 days? But basically, like, whenever you hit that date, you have to be released because we don't have funding to see people past a certain point. And so, that's a specific context, but then the therapy relationship ends there. Now, this is certainly not an exhaustive list of every single reason why the therapeutic relationship can end, but I hope it helps color in more of an accurate picture of what it tends to look like when therapy ends with a client, that there's so many different reasons, and to be prepared and expect that to be true. I used to carry so much shame when therapy ended for one of these, like many other reasons, other than like the client magically, naturally sort of being ready to graduate on the exact date that we had planned and, just releasing them into the world because they are ready to launch. If it wasn't like that, I used to think that I had done something wrong. I would consult on it a lot. And I think it is a good idea to consult in all of these situations. But like with a heavy heart, I would consult thinking like, what the heck did I do wrong? I messed up, or in a lot of contexts like this, then we can flip the script and blame the client and say, there's something wrong about them because they should be coming to therapy and they're prioritizing something else. And none of that has to be true. It may sometimes be true. We are capable of making mistakes. Let's not minimize that. And so we should always evaluate when therapy ends, like, how did that go? What was going on there? What do we think happened? And if there is some takeaway for us as far as like how to improve, absolutely 100%, we should always have that takeaway. And sometimes it really is like, okay, that person just like wasn't ready, and that's fine. So it's helpful to acknowledge that too. But there's no need for it to have to be this like either the therapist did something wrong or the client did something wrong, and those are the only available options, and we should be shaming one or both of those individuals if somebody didn't like beautifully graduate like the way that we sort of quote unquote are supposed to have them graduate. I don't know. Anyway, I think if we come into our work assuming that there's a wide range of reasons why therapy could end, again, some might not be even that deep. Then when therapy ends, we can have a much more objective eye to say, no, I'm really genuinely curious, like, what happened here? Like, maybe it really just was like therapy was a priority for a while, and now this person really wants to put that money towards school tuition because that's a goal that they also have in life. Like, good for them. That's awesome. Do it. And that we don't have to carry like judgment or shame or point fingers. We can just do our jobs and hopefully be more equipped to do our jobs well. And that our clients don't have to carry any of that pressure or shame or burden. Maybe they'll feel more comfortable to tell us if they know that, they're kind of done with therapy, if they know we're not going to take it personally. So if you take no other takeaway from this episode, I hope you learn to not just automatically take it personally or blame the client anytime therapy ends. I think it makes way more sense to have a sense of curiosity and an open mind about what might have happened. Bring it up in consult group, explore together, but no need to take it personally or judge anybody else. And a little bonus question that I wanted to reflect on with you all in the extended cut version of this episode is, when a client disappears, what do we do? Like, they ghost you, they cancel, and they didn't, reschedule or all of that. Are we supposed to reach out? And I was always taught early on to like definitely a whole lot reach out to everybody like at least 3 times if they've ghosted you. And I've changed that approach over time because I started to feel this sense that like this person's done. And so every time I reach out, it's just me like kind of pushing against a boundary that they've set. So for me, at this point, again, personally, and this is based on the population that I work with, I think the answer is going to be different in different places. But for me, I tailor how I respond to a person no-showing or ghosting for a while based on what I know of that individual client. There's going to be some clients, and this has happened before, where I feel like I know that person's character so well that if they no-showed and didn't reach out to me, it's so outside of their character that I know something is wrong. Something is wrong. I'm going to keep following up to make sure that they're okay because something happened that was completely outside of their character. But there's other people who I've already seen evidence that like this is maybe kind of how they approach a lot of things in life. And so in that case, if they kind of cancel and I never hear from them or that sort of thing, I might reach out one time. And if after reaching out the one time, I don't hear from them, I just let it go. I reached out the one time. They can follow up if they choose to. But, if I keep reaching out after that, it might just feel like, why is Marie contacting me so much? What's her problem? So that's a choice that I've made in how to kind of respond to these situations. And just a little bit of like, bonus conversation for those of you who are listening to the extended cut version of this episode. I thought it would be interesting, just for my own thought exercise, to think of all the different therapy relationships I've been in, like as the therapy client, and how those relationships ended. And looking back, I might have missed some, but I think I've had 6 therapists in my life. I know I'm a therapist and also, listen, I've been through a lot of stuff. The therapy was necessary. But out of all of those, like I can definitively say 3 of those therapists I look back on fondly, like thinking those were really positive, productive, therapeutic relationships. And 3 of them were absolutely terrible. I filed an ethical complaint against one of them, but honestly, I could have done that against the other 2 as well. So for the 3 therapists that didn't go so well. The first one I saw when I was 14, I saw him one time. He was extremely inappropriate. I could have filed a report against him for inappropriately touching me. I was 14, so I didn't know how to voice what was going on, and my mom was dropping me off to that therapy relationship. So I just told her when she picked me up, I'm never going back to see him again. And I'm sure she asked me why, and I didn't really truly answer. I knew the answer, but I didn't want to tell her the answer. So it was just like, I don't like him. I'm not going back again. That's all I remember about that. So I don't know what she did. Did she call the office or what? But that was Marie's, bailing on the terrible therapy experience. The other therapist I saw was a family therapist in high school who was absolutely unprofessional on just about every level you could imagine. And why I can't remember why we ended, but I just remember that it was bad. And I think my parents might have ended it. It was I have a messy family dynamics growing up. So yeah, there was, if you have a narcissistic parent and you try family therapy, like it's just not going to go well. Like that poor therapist is set up for disaster, and she just was not trained at all to deal with the situation she was handed. So I have a feeling that my mom might have ended that, my very narcissistic mom. But that's that one. And then my next therapy experience was in graduate school, and I really did not appreciate that experience. That experience I've spoken about on this channel before, and I ended it by filing an ethical complaint against her. And I let her know, actually, that was what I was going to do. I was still seeing her because I was required to see a therapist for so many sessions for my graduate training. And back then, they had a rule that if you switched therapists partway through, then you'd have to start over at 0. And I didn't have the budget to start over 40 therapy sessions at 0 when I'd already seen her for like 5 or something. So the rest of our therapy experience was just mostly me pointing out in our quote unquote therapy, I can't even call it therapy, pointing out all the things that were just wildly unethical that she was doing. So that relationship ended by me filing an ethical complaint, and then the ethics committee at my school granting me permission to finish my therapy sessions with a different therapist, not having to start over at 0, which I'm grateful for. Also, that was a terrible rule. That is a terrible rule. I hope they changed it since then. If you're listening, I hope you changed it. But I'm glad they granted that to me after filing an ethical complaint. And then the next therapist that I saw, I really liked him. I only had like 12 sessions left, but I did not have the budget to pay after 12 sessions. Like, that's it. So we ended because of finances. And, I finished my allotted 40 sessions, but I ended on a good note, and we both knew that was what was happening. And then post-graduate school, I've had 2 different therapists for different reasons, and I had positive experiences with both. And in both of those cases, we had the idyllic graduation ceremony type experience where with one therapist, we kind of tapered in frequency for a bit, knowing that I was stabilizing and improving until we kind of said, I think let's do whatever it was. Let's do 4 more sessions or something like that. And then we got to that last session and we kind of reminisced on our time together. And I worked with her almost weekly for 2 years until the end. And that was lovely. And then the other therapist, I think it was a much more structured set of, I forget how many sessions it was, but let's say 8 sessions, where we finished the structure after 8 sessions and felt like there was enough stability at that point based on what we were targeting in the therapy there to close things as well. And also because it's such a short-term therapy process, you kind of have a different relationship, I think, when you have a highly structured therapist who works with you for 8 sessions versus someone I poured my heart out to for 2 years weekly, but it still ended on a good note. So that was a long-winded side story, but those are some of the ways that therapy can end. I guess I kind of did all of them. I guess I ghosted my first therapist. I don't know if my mom stormed out on the second therapist or what, but it wasn't good. And oh goodness. Yeah, I've kind of had all the different kinds of therapeutic experiences ending therapy. Well, I hope you found this helpful, and I'm curious if I skipped over any reasons why therapy ends that we didn't touch on. And I'm aware that I come with so much bias. Like, I'm thinking of like, well, what about therapy ending with couples? Like, I don't work with couples. So, is there kind of a whole different gamut of reasons that happen there, or, depending on a workplace context and things like that. So if you have reasons to add that I didn't touch on, I'd love to hear them in the comments below. I hope you enjoyed this episode. I have fun kind of reflecting on the things that I feel like people don't talk about often, at least in my training or my circles, and maybe I'm just in a weird bubble and y'all are talking about it, in which case more power to you, but I'm just kind of putting it out there that there's all these reasons that I wasn't really taught about for why therapy ends. So there you go. It's out there now. And until next time, from one therapist to another, I wish you well.